Hello, class. And I would like to spend some time and discussing some concerns that I saw in the last answers or responses to the last quiz. When I gave the question was give the differences between health education and health promotion. Now, these are things that are clearly, the definitions are clearly on the book. They are in the book or the textbook for this class. And again, one of the advantages of having quizzes like this is to encourage you to also read the textbook. There's no reason for a student to do poorly in this kind of quizzes. When you have the book, you have the lecture notes, and you fail to use the book and the lecture note to help you respond correctly to the question. So please make sure only not even a handful really responded to the question correctly. I know you have the idea, but one of the biggest is health education. Yes, most of you said is part of health promotion. But with health promotion, there is also the political aspect, the policy. You see, health education is all the benefits is for you if you want to do it. But health promotion is slightly different. Is what do you do to impact your health and health of the others? And if it is perceived negative, then policies are developed to make sure that they protect your health as well as the health of others around you. That's why you have politics in it. You have all the resources within the community to come to play to making sure that your health is being protected. Some of those policies can be criminal. If you are told to do this and you decide not to do it because you want to act macho, yeah, there are certain policies that can be brought into play. You can be fined for not obeying the rules, because health promotion also deals with the health education aspect and also backed by rules. That if you don't obey those rules, you'll find yourself in trouble with the law. Okay, coming back to chapter 6, monitoring status of school health policy in the US. Now, CDC has periodically conducted a national survey to assess school health policies and practices. You see, as again, the Centers of Disease Control has once in a while conducted a national survey to assess school health policies and practices. Because most of the time, there might be some policies in place, but the practices can be different depending on the nature of the community, depending on the resources that are available. And at times also depending on the attitudes of the people within the community that houses the school. So just because there are school health policies does not necessarily mean everybody adheres to those policies and what is being practiced within the school. And some of it, as I said, could be based on resources, could be based on people's attitude towards certain practices, and the level of enforcement, how much of it that people in those schools really try to enforce those practices. Because if policies are there and they are not being enforced, there's no need to have them. School health policy and practices study, okay? Those are the things. Then assesses, say the school health policy and practices study, they assess school health policies, school health practices at the state, the district, the school, and the classroom level. I say, because again, how is that being practiced at the state level? Because if it's being practiced at the state level, it means there's support at the state level. If it's being practiced at the district level, which means there is support at the district level, at the school, and the classroom level, because all of these various stages have a role to play. The state will come up with certain guidelines shared with the district. The district shares those guidelines, those policies with the schools, and the schools share those with the teachers in the classroom at the classroom level. Now you have the component of whole school. You have the whole child and the whole community model. Everybody is in this, as they say, we are all in this together. All of these entities should be in promoting some of these things for the well-being of their students, the school-age child. Because as we said, children learn more or easier when they are healthy. It becomes a challenge when a kid is not healthy. And here, health can mean mental health, physical health, social health, emotional health. What is the background that that child is coming from? How healthy is that background, the home, that community? So all of these things have to really be on the same page, have to have the same level of commitment in promoting the health of the school-age child. Now, here are some of the components. You have the administration and organization. These are all various aspects: school health services, healthy school environment, school health education, counseling, psychological and social services, physical education and physical activities, nutrition, environment, and service, community involvement, family engagement, employee wellness. So these are all extremely important, especially family engagement, because the family is the extension of the school. If that family, say the child is taught to, okay, try to engage physical activities, try to eat healthy food. That is in the school. But if that is not reinforced at the home level, at the family level, then it becomes a real challenge for the child, because at the home also food is being prepared. Is this a healthy diet? Or are there other issues within the community? Do they have do they have options for them to really engage or to be able to buy healthy food? Now, or do they all they have around them is some of these convenience stores that is loaded with so many fatty, salty food, sugary food, that all it does is just encourages these young kids to eat and eat and start developing some issues like obesity? Or is the environment also safe enough for them to be able to engage in physical activities? Can they go outside and play? Or they are afraid to go out because of fear that they might be hurt? So most of the time, the school, yeah, is the people most of the time put most of the blame on schools. But in reality, it takes everybody. Even though kids spend more time with the teachers during daytime, but what is also within the environment, the sort of situations that are created around the environment also has a role to play. The family, is it a healthy family? Are they seeing good habits? Parent not smoking, not drinking, not using drug, or engaging in some reckless behavior. Because again, the family, the parents are the first teachers of their kids. Are they good teachers for health, or are they bad teachers for health? Administration and organization. Now, a whole school, whole child, and whole community model should be administered by the school health coordinator. So within the school, there is a school health coordinator, somebody who is trained professionally at the state level, at the district level or school level, who is responsible for managing, coordinating, planning, implementing, and evaluating school health policies, programs, and resources. So try to know the role of a school health coordinator. This is somebody who is trained professionally. Most of the time, some of them can be teachers, some of them can be uh, nurses. They are trained to at the state level, at the district level, and also at the school level. They are responsible for managing, making sure that whatever was agreed upon, whatever policies that we have developed, those policies or those plans are put into place by the right people, and was once on a time being evaluated. So making sure that, okay, the plans that were put in place, so for instance, the nutrition program, is the nutrition program properly implemented? Are we having the right type of nutrient that is being served to the student? Is the proportion appropriate? I say because if all we can say is we have it in writing and not really being properly implemented, then it's worthless. The needs of our kids are not being served. So the school health coordinator's responsibility is to make sure that those things are properly taken care of. Often not a position required by state. School health services. Health services provided by school health workers to appraise, to protect, and promote health. The framework for the 21st century school nursing practice calls for student-centered nursing care, focus on the key principles of care coordination, leadership, quality improvement, and community and public health with standards of practice as the foundation. These things have to be put in place, especially for some of you who might be going to say the classroom. These are things that you really have to understand. This is one very good chapter that you have to really, really understand, so that you see the different roles that different people play within the school system to address the health of their students. Healthy school environment. This is by law. School districts are required to provide a safe school environment. Part of this, at times they have no guns should be brought to school. No drugs should be brought to school. No cigarettes should be brought to school. And yes, conflict should be resolved in an amicable way. No fighting. Use of profane language. And these are all, the school environment has to be safe. These are expected for students as well as faculty members. Treat each other with respect. The physical environment, school buildings and its content. See, right now you have a situation, even now, people are talking about some of the barriers of allowing kids to go to school. return to school because of the COVID virus. Because in some school districts, the schools do not have proper ventilation, proper circulation of air. So there is the concern for the health of the student. See, what COVID has really done, COVID has brought most of those things that we have just said quietly, because of shame. Now, these things are discussed in the open. School system within a rich community, the buildings are in great shape. Ventilation, space, various structure, the technology, everything is in perfect shape. Schools that are in poor communities do not have some of these things. Lighting not proper, circulation, air circulation not proper, computer, internet connections not proper, and most of the time, some of those other issues also become an issue. A lot of behavioral issues. Because most of the time, when students are not meaningfully engaged, they result into behaviors that are not encouraged, which can lead to being expelled or suspended and losing meaningful time to learn. So school buildings and its content, the land on which the school is located, and the areas surrounding it. Land on which it's located, is this a landfill? Is this a land that is polluted, a toxic environment? Or is this school located close to a highway, the noise? Or is the school surrounded by poverty, run down communities? So because these are all things that when you're talking about the physical environment, trying to create a healthy physical environment should be addressed. School buildings should be strong, proper lighting, proper air circulation, proper internet connection, and those buildings should not be built on land that is polluted or close to highways, and areas surrounded by dilapidated communities, because all of those are distractions that can affect in a bad way the learning abilities of the student. The psychosocial environment, the attitudes, the values, feelings of students and staff. Attitudes. What are the attitudes of the teachers towards their students? Do they really believe that these students have what it takes for them to learn? Or do they think, oh, well, they are just going through their emotions? Think of some of their students better than others. And therefore, those that they think have, according to their preconceived notion, that have a better chance of learning, spend more time with those and ignore those students that they think, well, I don't think they can learn. Therefore, I don't need to waste my time. And this is not only for the teachers, it's for everybody that works within the school system, from the principal to the custodians to the teachers to who, counselors, the school nurse. Everybody should have that respect for each other, value each other, respect the students, give equal opportunities to the students, and you expect the same from the students. I said, because most of the time, the physical environment, the kind of environment that teachers and administrators create for students can go a long way in making that students feel good about themselves, feel good about their abilities, and really persevere to the point wherein they can succeed. Because there are times wherein certain times students might be coming from homes that are troubled. A lot of abuse, a lot of name calling, a lot of all those kind of things. But if the school environment create that positive attitude, that welcoming attitude, that family environment, respecting each student, encouraging each student, let students, each student feel, boy, my teacher likes me the most, even though that can be said by almost all the students, rather than having the students say, he does not like me, she does not like me, he does not even look at me, he does not even know my name. See, these are all things that has to be put in play if we are going to create an environment that is healthy for a student to learn. School health education, the development, delivery, and evaluation of a planned curriculum. Now, the priority health content of a health education curriculum is alcohol and other drug use. What is alcohol and other drugs? What are their health impacts? How can they destroy the mind and the body? And how students should refrain, stay away from using any of these drugs, alcohol and drugs. Because some of these drugs are addictive. You don't get to the point wherein you start using, because a student who starts using alcohol or drugs in their teens will be young adults who are addicts. And addicts are people who will be dealing with drug-related problems, either thrown in jail, can lose their jobs, and eventually can lead to sudden death. So it's extremely important that at very early age, students are told or are educated about the impact of excessive use of alcohol and other drugs. See, because alcohol is used in so many of our social activities. So by just the name alcohol in itself is not bad, the use of alcohol, but it's the excessive use. With other drugs, it's not matter of, it's don't. Because if you start using them, you become hooked, you become addicted, and it's very, very difficult to stop. Encourage students to practice healthy eating. Eat in moderation. Eat a diet, mixed, balanced diet. You have your veggies, you have your protein, you have your fat, you have all those things that helps you to provide the energy that your body needs for growth, that your mind needs for thinking, creativity. Then you have mental health and emotional health. Know how to control your emotions. Speak to somebody when you have something that is troubling you. Seek help. When you're not okay with something, or if somebody is kind of just mentally abusing you, talk to somebody. Try to be positive. Negative thoughts do not grow your mind, they destroy your mind. Negative emotions. Learn to forgive, because there are certain times people can do us wrong and we feel so bad, you don't want to. No, be the better person. Forgive. Clean your mind. Don't carry that baggage, because most of the time we end up carrying so much baggage that we don't need to be carrying. Clean your mind. Put love in your mind. See people for who they are. They are human beings. And as human beings, as the saying goes, do to them as you will wish them do to you. And most of the time, friendship, oh, nobody likes me. Okay, nobody likes you. But who do you like? It's a two-way. Show love and people will love you. You first stretch your arm and others will stretch their arms. So, personal health, keep yourself clean. Bathe, a frequent medical checkup, keep your environment clean, your body clean, and physical activity. Try, if you can, try to be physically active. If your environment, your place of, try to be and physically active. Safety and unintentional injury prevention. Stay away from guns. If you drive, drive wisely. Sexual health. Yeah, we are all sexual beings. But it is important for you to be smart about it. Nobody has died because they didn't have sex. But people have died because they've had the wrong type of sex. with the wrong type of person for the wrong type of reasoning. So yeah, abstinence is okay. It's okay. Don't just do it because everybody within your circle of friends are engaging in it. That's their choice. You make the wise choice to making sure that you are waiting for the right time, for the right person, and engage in it for the right reasons. Same thing with tobacco. Don't smoke. Oh, well, it makes me sexy or I can lose weight. That's dumb because it doesn't make you sexy. In fact, it makes you stink. Your breath stinks. Your teeth brown. Even your voice at with time will start to crack as if and the more you smoke, the longer you smoke, the higher the possibility for you to develop lung disease, in some cases cancer. So don't do it. Violence prevention. Find way. Always you be the first one to say, okay, I am not going there with you. I'm not going to fight you. People will start calling you names, CC or this. You know what? You are a much bigger person because you prevent violence. Know those things that can promote violence and do the opposite so that you don't engage in violence. There are better ways to engage people than violence. See those lives that are being lost because somebody at a very young age has a gun, not knowing that one thing with a gun, once you release the bullet, you cannot pull it back. Kill somebody else and their lives being ruined because they've killed somebody and their lives will be spent in jail, if not killed. So don't do it. Always walk away. You will be better for that. Walk away. Don't try to show who is more macho than the other. It's only small minds think that way. Big minds look at a potential situation that is potential for violence, then walk away. Those are the big minds. Development of us, development of and sources of health education curricula. Now, these are the sources wherein you can get some of those things that you need. There are many available from national specialists. You also have a pro-curricula from state department of health education or health. You have health agencies and associations, or you have commercially produced curricula or national health education standards. Now, one of the caution that I would like to put here is these are all good. They have the framework, the standards. But most of the time, the challenges is whatever is being developed has to be developed to address that particular group. What are some of the specific needs of that group? Because most of the time when you take this, the kind of one size fits all approach, there is where most of the time health education does not do too well. Because a health education curricula for people in wealthy environment should be slightly different for the health education curriculum for people in poor neighborhoods, because you have to address those issues in your curriculum. You have to address those niche issues. You have to make sure that those issues are clearly understood by your student and everybody within that community. So as you advance the learning process, you make everybody within that community engaged in the learning process, especially the homes. Because in today's environment, most of the time we talk about alcohol, alcohol, alcohol. In school, don't do it, don't do it, don't do it. Kids come home, who are their first teachers? Parents, 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 parents. What do they have in their cabinet? All type of alcoholic drinks. So now who is right? The teacher, the parent, or my parents? Again, there are times where in some of these things we have to marriage. Parents and teachers have to come together. If alcohol is going to be maintained in the home, kids should be educated how to use alcohol in the best way possible so that they don't abuse it, they don't start abusing it at very young age. And as with other health-related issues, so counseling, psychological, and social services, these are all other components. Physical education and physical activities, nutrition, environment and services, community involvement, and family engagement. Issues and concerns of school health programs. There's a lack of support for whole school, whole child, whole community involvement. And most of the time, when there is a lack of support, it is a real challenge for school health programs to succeed. Because when the stakeholders do not really put their support, it makes it very difficult for the teacher or the health coordinator to implement some of those health education policies that are required. School health curriculum challenges. Again, goes back to some of the resources. The idea that I was talking about. As with a lot of things in this country, there are 2 or 3 types. One type for those that have everything, one type that for those that so, one type that for those that have hardly anything. And trying to use a common curriculum for all is a waste of time. The foundation should be the same, but how to get there should be different. the core things, all trying to promote health should be the same. But how to get there should vary depending on the school system. And the balance in schools. Now teachers spend a good time of their time trying to manage the students, preventing fights. And where do these kids come from? From homes, from communities. What do they promote in those homes? What does the community encourage or allow? So most of the time, it's teachers are the easy one to blame, but in reality, you blame the homes, the communities, and the political systems, the sort of policies that are in place. How well are they enforced? What sort of environmental conditions do we allow some of our students to live in? Family structures? Because these are all the things that at the end of the day really impact the health of the student. You have limited success in getting whole school, whole child, and whole community implemented across the country. Because one thing about this country is there are differences from one school. In fact, you can live, and I hate to use this as an example. You live in Petersburg and Colonial Heights. A few miles apart from each other. If you look at the school systems, when you think of resources, there are differences. There are differences. And most of the time, when some of the essential resources that are needed to promote quality education are missing, it starts to create a difference at the attainment level. Some students can persevere and walk through or despite all the differences, but some students can be caught up. And most of the time, some students will drop out. So there is need, a supportive need for legislation. There has to be a real support. Now you have school health curriculum challenges, controversies. There are strong opinions on various topics, especially when certain topic as sexuality. That's a big topic. Some parents do not want their child to be educated as to how best can they engage in sexual activities in the best way possible at the appropriate time. They want those issues to be left to the parents to do the education. Well, how many parents do really do that? Where do these kids get their education, sex education? Most of the time from friends. Who got theirs from friends? Who got theirs from the street? and what are some of the qualities of that education. Most of the time, you see the outcomes: unintended pregnancies, engaging in drug abuse or other issues to satisfy certain desires. So, improper implementation, as I said, often provided by individuals other than health education specialists. See, most of the time, when it comes to teaching health education, they think, okay, just get a VCR and a tape or a disc from CDC, or just put it on and let the student learn. No, there is something different from somebody teaching health education without the health education background, being a specialist. Because when you say this person is a specialist, they know how to engage certain things, how to deliver certain things, and when to deliver certain information, and what sort of language should be used. You have barriers to school health education. Some schools have an issue with school health education. So provided in different ways. Most common on school property, school-based health centers. 7 core competencies used to guide the delivery of healthcare in a school setting. Have the cultural wars, funding challenges. Then you have high-profile incidents of violence in schools. Profile. Where are these kids coming from? You see, because kids are most of the time a mirror of the place they are coming from. If they are coming from an abusive home or an abusive environment, most of the time they are likely to exhibit that behavior in schools. So there are certain things wherein, it's so important that people should really be able to make sure that the families teach their kids how to deal with challenges. It's because when the kids don't know how to deal with challenges, that is when they engage in violence. Bullying, lack of respect of the order. Want to show I'm stronger, I'm macho, while in reality you are smaller and the most stupid and reckless individual. See, I, as an individual, have no regard for anybody who even tries to portray any attitude of bullying, because I see those people as midgets. They are small in their thinking. People should respect each other and not harass other people. Now you have this electronic aggression. This is new. When we were coming up, There was no Facebook, Twitter, and all those other names. But today you have Facebook, you have Twitter, you have this other Instagram, and posting things and doing all sort of things and just harassing others. These are things, when you really know, these are things that affect the mind. And when the mind is not healthy, when the mind is not feeling good, with time, the body also start not feeling good. And if not taken care at the appropriate time, can lead to sudden death. There are recommendations for improving school climate as it relates to violence. See, again, very, very important topics. It's a very, very good chapter, as I said, school health programs. Because there is where we start. We want our kids to have healthy environment, encouraging environment, supportive environment at all levels so that they can be healthy. Because we believe a healthy child has the ability to learn and can learn easily. When a child is not healthy, physically, emotionally, socially, and all these other form of illnesses, that child has challenges in learning. So we have to try to making sure that we really address the whole school, the whole child, and the whole community in trying to provide kids coming from those places the appropriate environment, the appropriate conditions, put them in the appropriate situations wherein they can learn effectively. Again, how can schools have more effective health programs with limited resources? Then we have to make sure that, first of all, we define what are the effective health programs. See, because most of the time, we might tend to blow the curriculum, make it too big. What are the key fundamentals that needs to be addressed? And see if we have funds to address some of those. And yes, always go after the funds from people who can support, some people who really believe in the next generation. Because regardless of how some people might think, providing a good learning environment for a Black kid is an investment for an old white guy down the road, because that Black kid will be paying taxes, will be contributing to the society. Similarly, the white kid will be paying taxes for the Black old guy. See, it's an investment. It's not one taking away money from, no, it's an investment. When we invest effectively in the proper development of our youth, we are investing in our ability to retire peacefully. be able to meet some of our needs at old age, because those young youths are now the ones in charge. They are now providing the funds. It's not one or the other. It's not every family in this country that has enough money on their own to live with till they die. Yeah, there's a percentage, but most families live on investment. You invest on their children, they grow nice, productive citizens, they pay taxes, make less, become lawyers or politicians or doctors, or so that they can take care of us at old age. Okay? So please, again, as I said at the start, when I give quizzes or exams, please, before you start working on those things, read the book. If you cannot answer the question offhand, read the book, because the answers are in the book. So please, let's do away with some of these lousy answers that you submit without really, as if you're not thinking. Read the book. If you have problems, please get in touch with me, because I want you to learn these things. I don't want you to go through this class just going through the emotions. No, there are certain valuable lessons you can learn from this class. Don't blow them away.